Welcome. A common question that's often asked about the heart as it sits in this protective cage called the chest wall is how do we access this vital organ. This chest wall, ribs, sternum or the breastbone actually makes our jobs harder as heart surgeons, because we've got to get through some portion of this to get to the heart itself. The heart sits behind the ribs and the breastbone. So the typical incision or approach to this is what's known as the median sternotomy or the midline sternotomy, where we cut the breastbone or the sternum from here down to here along the length of the breastbone, open the chest up as a book, do the work on the inside, and then close it up again, typically with wire. One of our contributions to this field is to try and improve the healing of this after the bone is closed, and our work with developing plates for the breastbone or the sternum have pioneered this new concept of what's known as plate fixation or internal fixation of the bone. This is the way bone is closed anywhere else in the body, but we as heart surgeons have been slow in adopting this. So we've pioneered that at the University of Chicago over the past 8 years. But then what we've also found over the past 5 years is that you can minimize trauma to the person, to the chest wall, by trying to hone in on specific areas of the heart. So if you can imagine the heart sitting like this being the aorta and the valve, the aortic valve being here, you can imagine instead of cutting the bone all the way down, we just make a small cut up here so that we just get direct access to the aortic valve for aortic valve surgery, the aorta for aortic aneurysm surgery, to reconstruct all this in aortic root procedures. Similarly, if we have to do a mitral valve or a tricuspid valve procedure, we make a small incision here. If you can imagine, this approach is directly looking at the valve from here. We just use long instruments. I call it chopstick surgery because the instruments are really long, but it works very well. Similarly, we now do bypass surgery through a small incision here. Up to 3 bypasses can be done very safely through this approach. And all of this allows much quicker recovery. And a lot of this has been facilitated by new instrumentation, better lighting, long shafted instruments that I talked to you about, and finally using plates to close the breastbone or the rib if we go in from the side. This has allowed elite athletes to get back to active sport quickly, high-risk patients to recover from something like this without too much in the way of problems, and has dramatically improved our outcomes over the past few years. So please feel free to look around and see if you find anything that would pique your interest. Thank you.